Hi, good afternoon, Franz.
Hi, Christine, good afternoon.
We meet again.
Again.
And now we are in London, and it's been a very good workshop here for these 2 days. Yeah. And today we want to focus a little bit on, sharing with the professionals back in Singapore and back in Asia. So can you share with us through your professional experience, what makes you embark on this journey to research on the theory of multigenerational psychotraumatology? Yeah, since 20 years ago. I mean, what makes you want to focus on this topic?
Because I've learned that most of the problems that we have, and they result from trauma, and they result from relationships, they result from early relationships with the parents, and their relationship with their parents, and so on. So you can say that sometimes the problem has a long history, the history before. And it's good to know that. You not only focus on what is going on in present time, but you know that it's a consequence. And this is very helpful. Otherwise, very often you blame yourself. I can't deal with that. I can't do that, and you feel guilty because you're not good enough. It's better to see, okay, this has reasons.
Okay.
And this theory of multigenerational psychotraumatology gives you reasons.
Okay. So can you share with us what is the major difference between MPT, the theory that you have founded, and of course plus the method, and most other mainstream methods used to treat mental, psychological and emotional issues?
I think what's the most significant difference between the conventional side of mental illnesses is that I say the concept of mental illness itself is a survival strategy.
Ah, right.
Yeah.
Okay.
In my concept, I have these three different structures: healthy structures, traumatized structures, and survival strategies. And if we look at the way as is talked about mental illnesses, is you have a depression, you have a bipolar disorder. It is like as if there's something. If it's something separate from the person, something separate from the history, the biography of the person, and then you treat the illness instead of dealing with the person, the biography of the person. Right. To make mental illness is something like if it is something extra, then you have to fight against depression or whatever. And it's not for me. It's nonsense.
Okay.
Because always we are those who have life experiences that maybe that we end up in a state of helplessness. Or we have a lot of anxieties that causes panic feelings. So there's nothing extra like a mental illness. And if we deal this, then we say we deal with mental illnesses, then in a way we avoid to look at the causes. We just deal with the symptoms, we get rid of the symptoms without looking at the causes.
So are you saying that there are currently, no other methods that is supporting the looking at the causes of symptoms?
No, for me, the difference always is, it depends from the psychiatrist or the psychotherapist, whoever is working, is if somebody looks at real causes. And this makes the difference. So, and then you know that it doesn't make sense to deal with symptoms, to try to reduce symptoms, to try to reduce depression or anxiety.
Normally through drugs.
Yeah, by drugs or whatever. So it's always this is the key for me. The key question is a person that says I'm a therapist. Is he looking at the real causes?
Okay. So why is it important or useful for all professionals to understand trauma?
Because it's the facts. Trauma is also a concept, theoretical concept, that says something happens. Okay. There are some facts that are not tolerable for the human psyche. Okay. Of course, depending from the age of the person. Right. But the younger you are, the less you can tolerate such events. The more you have to split them. And so this is trauma is the starting point for this development that may be ending up in symptoms that then the normal psychiatry cause depression or schizophrenia.
Okay.
Trauma is basic, the basic of all.
Yeah, because even back in Singapore, when I tried sharing with some of these professionals, they say they've never gone there, they never looked there. Yeah, so so is it different? Is it any different here in Europe or back home in Germany? Why would professionals be resistant to learning a new form of theory and method?
Because then you have to look at yourself.
Okay.
The person that, if you work with trauma, then of course you have to ask yourself the question, what are the traumas in my life?
Yes.
Yeah, and so it seems to be easier to say, I'm the doctor, I'm the expert,
right.
I'm the expert,
okay,
and there is the ill people and the patient. And I treat them, I help them.
Okay.
You feel good with that, yeah?
Yeah.
But if you see that in a way you're not so much different from the person that you are confronted as a client, yeah, they have the trauma, you have the trauma. That the level of you're more equal.
Equal, yeah, on equal grounds.
And this hierarchy.
Okay. So you feel that this is something that they are afraid of, or possibly?
And it seems to be good. We have this hierarchy level to be above the rest of the mankind.
Okay, sounds like a possible reason. So, can a professional, if they were to embark and embrace MPT and COI, can they mix these two methods? I mean, the theory and the method with an existing theory or methods that they are using. Can they mix it, or they must,
Every theory has its own background, and its own reason, have their own purpose. So it's mixing theories is it's not such a good way. Yeah?
Okay.
Just you have problems, and the question is, what theory is the best answer to that problem?
Right.
Yeah.
Okay.
And it's not about theories, but it's about solving problems.
Okay.
And so, if you, the same with me, I'm always looking around what else others are doing, what else others are using methods, or others are finding out, and then take whatever I think makes sense, what is useful, and integrate it in my theory.
Right.
Because it can help.
Okay.
So this openness, I think is necessary. Not to have my theory, and that, but really, scientifically speaking, is that if you find something better than what you have now as a theory, then the old theory is...
Yeah, it seems to be the way, yeah. Somehow or other, from quite a number of psychotherapies that I know here in Europe, they almost, are only using your theory for their sessions and their profession. So they almost make like a 180-degree shift.
Yeah, there's a difference between science and belief systems.
Okay.
Because in the science, if you know something that is better than what you had before.
Okay, that makes sense. Yeah.
Take the new one.
Okay. So why is it important for all professionals, to work on their own childhood relational traumas, other than the part that that we need to heal our own pain and
If you do not see yourself, and then you're blind for that what's coming out from the clients, or you might give advices to the client that you do not take serious for yourself.
Right.
That then you lose the credit. That nobody would believe in you when you say, "Oh yeah, he tells me something to do, but I don't do it for myself."
Yeah. So
this is
very important.
No good basis for a relationship.
Yeah.
And therapy is all about relationship.
Yeah. Okay, so lastly, any words of wisdom for the professionals back in Singapore and in Asia before we end?
Yeah, I'm very glad that this idea now spread by you, Christine, and you show them that there is something, and I would be very happy if they are open, and they dare, and they have the courage to learn something new, pick up something new. Even sometimes it is a challenge, a personal challenge too.
Thank you. And this is Professor Dr. Franz Ruppert from Germany, and we are having this live interview in London. Yeah, thank you.